Hello everybody and welcome back to Synapse. This is Ritika and in this video we are going to talk about emphysema. Emphysema and chronic bronchitis constitutes chronic obstructive pulmonary disorder. Emphysema is the abnormal permanent enlargement of the air spaces distal to the terminal bronchioles along with destruction of their walls but without any fibrosis. There are four types of emphysema, among which centriacinar and panacinar emphysema are clinically more relevant. Centriacinar emphysema involves the more proximal part of the system, mainly the respiratory bronchioles, while the panacinar emphysema involves the entire alveolus and the alveolar ducts. Centriacinar emphysema majorly affects the upper lobes of the lungs, and the main risk factor is cigarette smoking, while panacinar emphysema mainly affects the lower lobes of lungs and is seen in individuals with alpha-1 antitrypsin deficiency. The third type is the distal acinar emphysema, where only the distal part of the acini is involved, and the pathology in this is very close to the pleura and the margins of the lobules. In this, you also see multiple contiguous enlarged air spaces, which when enlarges is referred to as bulla. The fourth type is the irregular emphysema. Now let's look at the pathogenesis of emphysema. The environmental factors and the genetic factors play to stimulate the inflammatory cells, which produces cytokines, mainly the interleukin 8, and proteases, mainly the elastases. This leads to extracellular matrix degradation and epithelial cell damage, which eventually leads to alveolar parenchymal damage. Normally, anti-elastases, mainly alpha-1 antitrypsin, inhibits the action of elastase and prevents the damage of the lung tissue. This is why individuals with alpha-1 antitrypsin deficiency are more prone to developing emphysema. Let's look at the morphology of an emphysematous lung. In panacinar emphysema, the lung is pale and voluminous, while in centriacinar emphysema, the lungs are pinker and less voluminous when compared to that in panacinar emphysema. Histologically, there is destruction of the alveolar walls without fibrosis, which leads to enlarged spaces. There is loss of elastic tissue in the alveolar septa surrounding the small airway, which reduces the radial traction on the small airways. And this leads to the collapse during expiration, and this leads to wheezing. The clinical features of emphysema includes dyspnea, which is progressive in nature and is associated with prolonged expiration. There could also be weight loss seen in the patients, mimicking malignancy, barrel-shaped chest. Pulmonary function test will reveal decreased forced expiratory volume in first second, that is FEV1, but the FVC, which is forced vital capacity, is normal, and thus the ratio FEV1 to FVC is reduced. There is also decreased diffusion capacity. Despite decreased diffusion capacity, the oxygenation of the hemoglobin is maintained because of hyperventilation, and thus these patients are also called as pink puffers. Pink because oxygenation is maintained, puffers because of hyperventilation. In contrast to the conditions seen in chronic bronchitis, where you observe hypoxia, and thus they're designated as blue bloaters. That's it for this video. I hope it was useful, and if it was, do like the video and share the video and subscribe to our channel if you haven't yet. And if you have any video suggestions, drop them in the comment box below. Love you. Bye bye. Thank you.